Well, a very good afternoon to you, Rami Obusiku, and our audience. I am coming to you from Kigungu Health Center 3, and this is one of the health centers that were left to man other illness within people after Entebbe Regional Referral Hospital was locked to COVID-19. And actually from here on ground, you can see there are no patients. People have not come to receive treatment here at the facility. It is empty for when we have been doing a tour around with the Entebbe leaders who decided, of course, to do a check and see whether people are still getting health services here. But from the point of view, I can tell you that there are no patients here in the facility. Well, we know very well that besides COVID, there are other illnesses that people are grappling with. But that, of course, gives you a question. Is it that people are not sick? Is it that the other lower health facilities are not giving health services to people? And the Entebbe leaders that are led by the division B chairperson, who is Section Richard, have just been doing a tour here. And what I can tell you is that inside the facility, we have not even been able to see the in-charge or an assistant. And that has left a question whether the people, whether the health workers are also ready in the facility, that in case of any emergency, someone can come to such a lower facility and get treatment. But well, with me is the Division B chairperson, who is Section Richard, to just paint for us a picture of what they have come up with, given the tour or the assessment that they have been doing. And welcome with me on NTV1. Good afternoon.
Good afternoon. How are you?
Yeah. What can you tell us from your assessment exercise that you have been undertaking in these lower health facilities?
First of all, I would like to thank NTV for this opportunity being available to us. We decided to make this tour and monitoring to check on how are the things moving on the ground, because this is the only health center we have in Division B. It's supposed to serve Kigungu ward and the Chiwafu ward, even plus the other neighboring islands, that is Busi and Kachanga. So as you have seen on the ground, the number of patients is it's not that much. It's due to challenges of transportation, and it's mostly serve the people within Kigungu and the other islands. But you find that other people from Chiwafu, for them, they normally go to...
Chairperson Division B, if I cut you short, where we are standing now, we have not been able to find the in-charge or an assistant in the hospital. What do you make of that?
Yeah, I tried to rang the in-charge because I informed him yesterday that I will pass by. Then he told me that her deputy or her deputy will be here, but unfortunately we found her not around. So as you've said, there is a bigger question, there is a gap, it needs to be fixed.
Well, for time purposes, Chairperson, let's leave it there. But that is evident that perhaps more other health facilities are still going through the same challenge here, from what we have found here at Kigungu Health Center 3. But well, for now, let me get back to you in the studio, Rami Obusiku. A very good afternoon to you and our audience.